afternoon, Mr. Stone.
Good afternoon.
How are you today?
I'm fine, thank you.
Brilliant. So we're just going to take a quick medical history from you. Just can I confirm your date of birth just before we start?
Yeah, it's the 18th of June, 76.
Brilliant. So just a couple of questions before we start. Do you have any allergies?
I don't.
Do you have any problems with your heart that might give you an increased risk of valve infection?
No, I don't think so, no.
Good stuff. And do you have any medications that might thin your blood at all?
No, I don't.
Great. So I'm going to run through medical history. I'm going to start from the top of the head to the tip of the toes. We'll just go through it like that.
Okay.
So just to start off, in regards to the brain, you don't have any problems with epilepsy or migraines?
No, I don't know.
No fits, faints or funny turns?
No.
No. And moving on, so have you got any hearing or visual impairments?
I don't. That's all fine.
No. And sort of regards to your hormones, you don't have any diabetes or thyroid problems?
No, okay.
Yeah. And so moving on to your heart, do you have any heart disease, any high blood pressure at all?
Yes, I have high blood
High
pressure.
blood pressure?
Yeah.
Are you on any medication for that?
I am, what's it called? Ramipril?
Ramipril? Yeah. And do you know how many of those you take daily?
I take 2 of those a day.
And do you know the dose by any chance?
I don't, but I have brought them with me if that's any help.
Yeah, that's great, thank you. So 2.5, brilliant, thank you very much.
No problem.
And is that well controlled at the moment?
It is, yes.
Yeah?
Yes, it is.
See your doctor regularly for that?
I see him every 6 months just to check it over.
Yeah, fantastic. And so nothing else wrong with your heart at all?
No, that's all fine.
No. And sort of moving on to your lungs, you've not got any tuberculosis or respiratory disease like asthma?
I do have asthma, yes.
Yeah.
Yeah.
And how is that controlled?
I have an inhaler for emergency use.
Yeah.
Don't really sort of need it very often.
When was your last sort of asthma attack, would you say?
You're looking about 5 years really.
Right,
So
okay.
a while.
And do you have your inhaler with you today?
I don't normally carry it now.
No. So it's well controlled, you're not worried about that at
That's
all?
fine, yeah.
Okay, great. And sort of moving on to your your stomach area, have you ever had any gastric bleeding or ulceration, heartburn or acid in the mouth?
I do have GORD if that's what you're looking for.
Yeah, okay. Are you taking any medication for that?
Yes, I'm on omeprazole.
And is that once daily?
Yes, it is, yes.
Do you know the dosage by any chance?
I've brought those with me again, so
Fantastic.
you can check the label.
Yeah, so 20 milligrams, that's great. Thank you very much.
Smashing.
And in regards to your liver, no hepatitis or jaundice in the past?
No, that's all fine.
No. And the kidneys, the waterworks, no burning or itching?
Yeah, it's all
Okay.
working fine, yeah.
Yeah, and no disease related to intercourse at all?
No, that's clear.
Brilliant. And regards to your bone and movement, no arthritis or movement disorders?
No, I move just fine.
Great. And any skin problems at all?
No, that's all clear.
No. And you haven't been in hospital for any serious illnesses within your life?
No, never been kept in.
No, no general anaesthetic?
No, just the odd sprained ankle really.
Okay. And you've not been abroad to anywhere exotic in the last sort of 6 months?
No, I wish.
No problem. So just moving on to a bit of family history. Is there anyone in your family who's got any diseases at all that run in the family?
My brother's got diabetes type 1.
Yeah, okay.
And my granddad's got type 2.
Right, so a little bit of diabetes in the family. So just to finish off, just some social history questions. Are you a smoker at all, Mr. Stone?
I do smoke, yes.
Yeah. And alcohol, do you consume sort of on a weekly basis? How
How
much
much
would
a
you
day?
say?
Yeah,
Like a beer?
around sort of 30 units, I reckon.
Yeah, okie doke. So just make a note of that. So that's brilliant. We can continue on with our further investigations now. Thank you
Lovely.
very much.
No problem.